Finally, we got interesting and funny subject from psychiatry. It is funny for doctors out of hard work. Let me explain how I see these patients with factitious disorder. They are mimicking some disorder, looking for a doctor without any reason or goal, and even they do not suspect it. And it is derangement for both for doctor and especially for patient, as can interfere of course with daily life. So let's talk in detail about it. Factitious disorder symptoms can range from mild, like slight exaggeration of symptoms, to severe, previously Munchausen syndrome. The person may make up symptoms or even tamper with medical tests to convince others that treatment such as high risk surgery is required. Factitious disorder is not the same as inventing medical problems for practical benefits such as getting out of work or winning a lawsuit. Also, people with factitious disorder know they are causing their symptoms or illnesses. They may not understand the reason for their behavior or recognize themselves as having some problems. Factitious disorder is challenging to identify and hard to treat, of course. However, medical and psychiatric help are critical for preventing serious injury and even death caused by the self-harm typically of this disorder. And now it's time for definition. Factitious disorder is a serious mental disorder in which someone deceives others by appearing sick, by purposely getting sick, or by self-injury. Factitious disorder also can happen when family members or caregivers falsely present others, such as children, as being injured or impaired. Risk factors. So several factors may increase the risk of developing factitious disorder, including childhood trauma, such as emotional, physical, or sexual abuse, a serious illness during childhood, loss of a loved one through death, illness, or abandonment, past experience during a time of sickness and the attention it brought, a poor sense of identity or self-esteem, personality disorders, depression, desire to be associated with doctors or medical centers, so seeking attention, work in the healthcare field. So any kind of stress situation can be a risk factor. And factitious disorder is considered very rare because it is very difficult to detect it. But it's not known now. It's not known. Many people have the disorder. Some people use fake names to avoid detection. Some visit many different hospitals and different doctors, and some are never identified. And from statistics, we can see that very low number of patients with disorder are detected. Very difficult to get a reliable estimation, of course. Symptoms. Symptoms of factitious disorder involve mimicking or producing illness or injury or exaggerating symptoms or impairment to deceive others. People with the disorder go to great lengths to hide their deception, so it may be difficult to realize that their symptoms are actually part of a serious mental health disorder. They continue with the deception even without receiving any visible benefit or reward. They are not looking for benefits or rewards, or when faced with objective evidence that doesn't support their claims. Factitious disorder signs and symptoms may include clever and convincing medical or psychological problems. So extensive knowledge of medical terms and diseases, vague and or inconsistent symptoms, conditions that get worse for no apparent reasons. You are doing some lab studies and don't see any problem, any pathology, conditions that don't respond as expected to standard therapies, seeking treatment for many different doctors or hospitals, which may include using a fake name, as we talked previously, reluctance to allow doctor to talk to family or friends or to other healthcare professionals, frequent stays in the hospital or hospitals even, eagerness to have frequent testing or risky operations, many surgical scares or evidence of numerous procedures, having few visitors when hospitalized, and arguing with doctors and staff as they are knowing a lot of information about the disorder or the disorders they are presenting and simulating, as they are knowing how this disorder looks like. Next one is diagnosis. Diagnosing factitious disorder is often extremely difficult. People with factitious disorder are experts of making different diseases and conditions, and often they do have real and even life-threatening conditions. So these conditions may be self-inflicted. The person's use of multiple doctors and hospitals, the use of a fake name, and privacy and confidentiality regulations may make gathering information about previous medical experiences difficult or even impossible. Diagnosis is based on objectively identifying symptoms that are made up rather than the person's intent or motivation for doing so, to help determine if someone has factitious disorders. A doctor may suspect factitious disorder when the person's medical history doesn't make sense. So a patient is talking to you about some symptoms, but they don't make sense as you see something different from patient. No believable reason exists for any illness or injury. The illness does not follow the usual course. There is a lack of healing for no apparent reason, despite appropriate treatment. There are contradictory or inconsistent symptoms or lab test results. The person resists getting information from previous medical records. In this way, you can compare previous medical records and see if the disorder is real. Other healthcare professionals or family members. No information from anyone, just directly from patient, as they are trying to control this. The person is caught in the act of lying or causing an injury. Helping to determine doctors the following: conduct a detailed interview, require past medical records. So patient is telling you something, but you have to do your work and ask for this detailed interview. Past medical records. Work with family members for more information if the patient gives permission, especially. In many countries, this one is very important and is not allowed without patient permission. Run only tests required to address possible physical problems. and may use the criteria for factitious disorder in the Diagnostic and Statistical Manual of Mental Disorders called DSM-5. It's a last edition, published by American Psychiatric Association. The last one is treatment of factitious disorder. Often focuses on managing the condition rather than trying to cure it. Treatment generally include having a primary doctor, care, psychotherapy, talk therapy, or cognitive behavioral therapy also called medication, and hospitalization. So having a primary doctor mean using one doctor or other gatekeeper to oversee medical care can help manage needed care and the treatment plan and reduce or eliminate visits to numerous doctors, specialists, or surgeons, as they are looking for even surgery, plastician, or any type of. Cognitive behavioral therapy may help control stress and develop coping skills. If possible, family therapy also may be suggested. Medication may be used to treat additional mental health disorders such as depression or anxiety. And it helps a lot if you are giving antidepressants also. In hospitalization, only in severe cases, a temporary stay in a psychiatric hospital may be necessary for safety and treatment. Treatment may not be accepted or may not be helpful, especially for patients with severe factitious disorder. In these cases, the goal may be to do a further invasive to not do further invasive or risky treatment. Thank you very much for your watching. Hope this video is useful, and of course, if you like it, you can subscribe or click like button. Have a good time, guys.